Yeah, so thank you guys. Welcome. Everybody got enough to eat? Got something to eat? Cool. Feel free to have seconds and thirds. I'm sure we'll have plenty left over. So I know all you guys. I'm pretty sure everybody looks like a familiar face. So yeah, a lot of the reason that we're doing this, because a lot of you guys that have been with me for a long time, you know that we've changed the name here, 6 times, 5 or 6 times. We've changed our model. We've always tried to sort of stay up to date with what's changing in healthcare, and as we grow and want to change, we have to implement that in the practice too. And another reason is that patients are getting much sicker. So the cases that we see now versus 18 years ago when I started practice, night and day difference. So before, we could adjust people 1 or 2 times, adjust a kid once, his ear infections go away, adjust somebody 5 or 6 times and their digestion clears up. But now I just think the burden that people are under from a toxic load and hormonal and inflammation, and it's just so much more. It's just harder to keep up now with just the traditional standard of care. So, and the other reason is because I'm sick and tired of beating my head against the traditional medical model. Take pills, have surgeries. If the organs don't work, just cut them out, which has value. But the realization is that system's never really ever going to change. So why don't we just make our own healthcare system? So where we can do things that we want to do that actually get to the root cause of people's problems. So that's why we're going through this transition. We've got Nurse Liz, who's an amazing add-on. You've been doing this how many years? Without giving away your age?
About 20.
Yeah, like 20 years. So she's seen it all, done it all, and we'll kind of talk about some of the offerings that she has and how she can help you reach your health potential. So I wanted to start with a video that kind of encapsulates really the problem with our healthcare system. And it was an interview by Joe Rogan. He interviews Dr. Peter Hotez. I don't know if you guys have seen or heard that. During COVID, Dr. Peter Hotez was kind of pushed out in front as sort of the lead expert in health and longevity and vaccinology. And he was the one that was telling you got to get your Pfizer shot or your Moderna shot. And I think it's pretty telling how some of this is broken down. So
about your diet?
I'm not as cautious about my diet as I should be. I'm a junk foodaholic, actually.
Well, that seems like a terrible thing for your health.
It is a terrible thing for my health, and something my wife is working on.
But that seems ridiculous for someone who works with health.
Yeah.
What's going on with you, man?
Sometimes, man, I just don't get it right.
How often?
What?
How often?
How often do I steal a bag of chips or something like that?
How often do you eat garbage?
I don't know. No, hopefully not every day, but
hopefully not every day.
Yeah, maybe a couple of times a week.
Oh.
That's what with Rachel, my daughter with autism. That's like our thing is to go to the it's called the burger joint or to Shake Shack to get a cheeseburger. We'll sneak some fries.
So you
live in large, we call it.
Like that mouth pleasure so much, you're willing to sacrifice a little bit of health.
I am, yeah. I have to concede that's the case.
Well, there's, I don't have to tell you, but there's a large body of data that connects poor diet to a host of diseases. Mm-hmm. That seems like a crazy decision for a guy in your line of work.
There you go. Sometimes it's not all brain. It's something else.
But if you ate healthy food, the thing is your body starts craving healthy food. You start feeling
no question,
results.
no question about it.
Do you take vitamins?
I don't take vitamins.
Really?
Yeah. I
Wow.
don't think they do. I don't think they're needed because most in the
American. Hold up. You don't think they're needed while you're eating junk food?
Well, hopefully I'm not only eating junk food.
Okay,
right?
But there's a large body of clinical research on the efficacy of vitamins, especially vitamins D, vitamins B.
I have taken vitamin D for periods, the recommendation of my internist. Yeah.
What about essential fatty acids, which are great for your brain, fish oil, all these different things that are fantastic for
I'm not going to argue with you.
What is going on with you, doctor?
You got it. You got it over me. Yeah.
You got to listen, but you would have a much better argument, don't you think?
You're making my wife stay here.
If you're taking care of yourself 100% instead of just concentrating.
But you still need your vaccines.
I'm sure you do, but vaccines aren't going to prevent cancer.
No, that's true.
Right.
That's true.
There's a lot of diseases.
Or diabetes or cardiovascular disease.
And a lot of these diseases are connected directly to diet.
Right.
Yeah. come on, man.
And other lifestyle changes.
Yeah, good. You get exercising.
Sedentary life. I try to go on the treadmill for 30 minutes every morning. I do it. Actually, I'm pretty good about that.
Yeah?
30 minutes every morning.
Why don't you just go for an actual walk? It's more interesting.
I do that too. So I do 30 minutes on the treadmill in the morning, and then I take a long walk with my wife in the evening.
Oh, that's good.
But the thing that knocks the crap out of you is the travel.
Yes.
I find that very frustrating because you don't exercise and then you don't eat well, and you don't control the diet as well. So that's
well, I have a solution to that. And eat well and exercise. Those are solutions to that. Just do it. You know, I treat it like I'm brushing my teeth. I brush my teeth every day.
Yeah.
I exercise every day too.
Yeah.
So when I travel, I don't have an option. When I land, I go to the gym. This is how it goes. I land, I get in my hotel room, I put my shorts on.
Yeah, I do that too. I do that too.
It's the only way.
Yeah.
If you have to do it, if you say this is just what ggets done, this is how you do it.
Yeah, I try to be really compulsive about that. So
yeah, I have it written out. I know what I'm going to do, especially if it's great if the hotel has a good gym. The hotel, if they have weights and a bunch of different.
Or I'll run outside if we don't have it.
You run?
Yeah.
Do you?
Not very well, but
but you do. Okay.
Yeah.
We got to get you healthy, buddy.
Yeah.
Can't be pushing only chemicals in injectable forms to facilitate health.
Fair enough.
Yeah.
Not chemicals, they're vaccines.
Oh, I'm sorry. What's in them?
What?
It's not. I mean, it's some sort of chemical. No.
No, they're antigens, right? They're
What's the fluid?
Macromolecules.
What's the liquid stuff?
Typically, it would be saline or salt water. And
right. Very telling. Right?
Yeah, absolutely.
Especially now that we.
Very telling indeed. So, and I don't like to pick on people but if you put yourself out there as a leading health expert and you're blaming and shaming and guilt tripping people because they won't get their vaccine because they're killing other people around them, I think you're fair game at that point. So, and that's not just his opinion. That is the prevailing notion in the modern medical system. Take your pills, blood pressure, cholesterol, get your shots. Don't worry about your nutrition and diet. That's exercise. That's a good idea, but at the end of the day, it's not the biggest thing. So if your doctor prescribes pills, he doesn't talk to you about your diet and your exercise and your sleep and your mental health and your relationships and your love of your job and vocation, and all they do is subscribe you pills and medications, then you go to a legalized drug dealer. You don't go to a health practitioner. You don't go to a health expert. So that's why we're trying to change the system. So the goal, and this is, for people that want to get 60 to 100% better, I think that's the name of the game in terms of, because we know if our health is better, if we have more health at a higher level, then our energy is better, our relationships get better, our finances are better because we don't spend as much on drugs and chemo and insulin and all these other medications. So our health is really primary when it comes to life. So how you can get relief, that's what today is about. And the first thing we're going to talk about is pain-related syndromes. So we have a lot of people with knee pain. Anybody with knee pain in the room? That's usually about half the room generally. Back pain, that ought to be most of you guys, hence you're here. Joint pain, so hips, shoulders, knees, ankles. It's really epidemic in this culture. So the other one is hormonal imbalances or problems with hormones. And it varies a little bit from men to women in terms of the symptoms that they experience. But some of the common ones are acne and mood swings, anxiety or depression, fatigue or low energy, having brain fog, irregular cycles, insomnia or problems with sleep, and then also headaches. And that's just the short list of problems when our hormones are out of balance. And we have a cultural, because if you look at other cultures, if you look at the blue zone cultures like the Okinawans or the Hunzas or the Abkhazias that are in these pockets around the world of people who literally live till 80, 90, 100, sometimes over 100 in really great health. They're on no medications. They move around. They are respected in society versus here where we shuttle people off into a nursing home and we try to avoid them. It's just a completely different, it's really a different society because of how healthy the health of people in those cultures. So there's some commonalities in that they eat the right foods. They move their bodies in ways that are appropriate for the human species. I mean, if you had a giraffe that was sick, you wouldn't ask, well, what cocktail of drugs should we put the giraffe on? You'd say, well, what did he eat? Does he get enough water? Does he get enough exercise? But somehow with our bodies and with humans, we think we're somehow disconnected from like the animal kingdom. But we're just animals. We have the same basic requirements as most other mammals do, different based on the species, but we're essentially, we all have the same basic needs. And our genetics, see, genes are what most of this gets blamed on. Because if you've got bad genes, then you're in trouble. Nothing you can do to really make a difference. If you've got good genes, then you got the golden ticket. And you can live to 100 and not have to worry about eating or smoking or whatever you do. But the reality is, our genes have changed in the last about 10,000 years. Our genes have changed about 0.004%. So minuscule amount of genetic change. But you see in the last 75, 80, 100 years, the rates of cancer and depression and arthritis and allergies and heart disease and diabetes have absolutely skyrocketed. There's a great a picture that's going around online where it shows like a picture of the beach in the 70s. Like you see all the people on the beach, not one person overweight. And then you see a picture of today's beach and it's completely swung in the other direction. So it's our lifestyles. That's what I'm going to beat across, our lifestyles. So after today, we're going to talk about the challenging truth of standard treatment for these problems and then some proven methods for creating some lasting relief, if not resolution of the problem, and then steps that you can take to get on the road to feeling better. So let's talk about arthritis. I don't love that word because a lot of times patients will bring that term to me when they first come in. They say, you know, my doctor just told me that I have arthritis. And that's one of those, generally it's one of those garbage diagnoses, like I'm doomed, there's nothing I can do, I'm going to have to live with this for the rest of my life, it's only going to get worse. That's the connotation that comes along with arthritis. So a lot of times when you tell people that that's what they have, then it's essentially like a death sentence. And then they live their life according to that notion that's in their head. Like I can't go upstairs because my knee has arthritis, or I can't ever do any exercise because I have arthritis. When in reality, movement and exercise is one of the best things you can do for arthritis. So the reason that joints break down is because they lose normal function. So if grandma's left knee is out of alignment and her right knee is in perfect alignment, which knee gets arthritis first? That one. Is that because of aging? No. How old's the good knee? That's what people say, oh, my shoulder's going bad because I'm getting old. I'll say, well, how old's your other shoulder? I'm like, well, yeah, I guess you got a point. So it's not age, it's how long it's been down and the degree of damage and the degree of dysfunction. So technically, arthritis is inflammation in one or more of your joints, pain, stiffness. The most common type is osteoarthritis. They call that the wear and tear arthritis. There's also inflammatory arthropathies like psoriatic arthritis and rheumatoid, and there's a list a mile long of those. And it's deterioration of the cartilage, which is found between the joints. So they lose their mobility, they get stiff, they get inflamed, and then they actually cause pain. So this bone-on-bone pain, about 49% of people 65 and over have a doctor-diagnosed arthritis. So that's about half the population. And there's probably another 20%, if you got them to the right doctor, they'd probably give them that same diagnosis too. So it is very common, but it's not normal, and there are ways to actually reverse that. 40% of older adults take 5 or more prescriptions, and nearly 20% take 10 drugs or more. And that number gets worse every year. That's from 2021, so 2 years later, the problem's just going to keep getting worse and worse and worse. We know about 50% of women over the age of 40 are on mental health drugs, so Xanax and antidepressants, and you name it, the list is a mile long. We know that about 25% of our kids are on what's called a chronic medication, which means they're taking a drug today that they're going to stay on for the rest of their life. So more drugs, keep piling on the drugs. Now you have to take this drug to offset the symptoms of these drugs. And drugs have utility. I'm not here to say there's never a time and place. I've told this before. I'm like, my sister's type 1 diabetic, so if she didn't have her insulin, I would not have a sister. So there is a time, there is a place, but the vast majority of medications never fix the root cause of the problem, and it's like taking the batteries out of your smoke detector. Fix that problem, right? So all the time we're covering those symptoms, the problem keeps getting what? So there's a disturbing trend in pain management, and this is kind of centered around the opioid crisis. And by the way, that's a pharmaceutical company created crisis. They wonder why we don't trust those drug companies, because they operate like a psychopath. Not that the CEOs are necessarily psychopathic, which I would argue some of them probably are, and not that the doctors are psychopaths or the staff, but the entity of the drug company itself operates in the psychological dictionary. It operates very much like a psychopath. It doesn't care about the harm done to others. It's only about itself. Its one purpose is to benefit itself and to hide and minimize and downplay harms and risks. Just very much like a psychopath. So it's not that the people in it, but the momentum of that system just carries it in one direction only. So this is back pain. You have a normal healthy spine with a nice curve. You have a good healthy disc, and you have nice round vertebrae, and then that allows an opening for a healthy nerve. Now what happens, and most of you guys already know this or you're under care for this, is when the spine shifts out of its normal position from a fall or an injury or sleeping on your stomach or having a rough C-section delivery or bicycles and trampolines and heavy backpacks and cell phones, then it moves the spine out of its normal position, and then your body begins to treat it like a broken bone. So the body's response to something that's unstable is to try to create more stability. That's what bone spurs and degeneration and arthritis, that's what those things are, is your body's attempt to try to stabilize something that's unstable. So it's actually it's kind of a brilliant process by the body. It's not inherently a bad thing, it's your body doing the right thing given the circumstances. So knee arthritis and cartilage degeneration. A normal knee has a nice healthy spacing. This is the inside of the knee, this is the outside of the knee. And you see the spacing on either side is pretty nice and even. There's no jagged edges. But then when we have trauma or falls or even pelvic imbalance, we have a ton of people just because their pelvis has been like this for 30 years, they're walking around with their wheels out of balance on their car. So the tires begin wearing out asymmetrically. That's a lot of what happens with people's knees. And some of the current options are ibuprofen, aspirin. And do you know if a woman takes ibuprofen 200 milligrams a day for the course of a year, which seems like who would do that for the course of a year? But there's a lot of people that do. You five-fold increase your risk of breast cancer. It skyrockets. And you could probably say the same with aspirin. You remember the aspirin a day recommendation from the FDA? Do you know they withdrew that? They used to say take a baby aspirin every day. Well, they don't recommend that anymore because they know that it creates ulcers and other problems that are much bigger than the small benefit that it created. And taking omega-3 fish oils is just as blood thinning and much more anti-inflammatory than taking an aspirin. Do you think we were born with an aspirin deficiency? No. So why would we need it every single day in order to be healthy? And then acetaminophen, which is also known as Tylenol. So those are the most common over the counter. And then some of the side effects are ulcers and bleeding. We know it leads to high blood pressure, fluid retention, problems with kidneys, heart issues. And that list, that's the short list. And then cortisone injections, which again, I'm not totally against those. I think those have utility and they have value in certain times. But you realize they'll only do a certain number of those per year. Do you know why they limit the number of cortisone injections you can get? Because trust me, the doctors, if they get paid for it, they'd be happy to do it every day if you needed it. But they do it because it destroys the joint tissue. So it thins out the bones, also known as osteoporosis, which we have an osteoporosis epidemic in this country. It gets worse every single year. And what are we told to do for osteoporosis? Calcium. Drink more milk, right? That's what how do we go? We've been brainwashed so effectively that our first go-to when we see that word osteoporosis is pasteurized cow's milk. Like we're the only species of animal that drinks milk after they're weaned from their mother. You realize that? Like bunny rabbits don't keep drinking milk. Kitty cats don't drink it unless you give them a dish of it, right? So we're the only, and we don't even drink our own species. We drink like a big 500-pound cow's milk, not even like mom's, right? And calcium that comes from cow's milk, because it's been pasteurized, you absorb essentially none of it. And the U.S. has by far the highest rate of milk consumption. And guess what we also have the highest rate of? Correct. So it ain't working, is what I'm trying to say. Easy bruising from cortisone, weight gain. It affects your adrenal glands. It causes a lot of hormonal disruptions. High blood pressure, cataract formation, and thinning of skin. And then this is a gruesome picture of a open knee surgery. The cortisone is essentially like battery acid to the joint. So if you can think of it, that's probably a far too simplistic way of looking at it, but that's a good reference. It's essentially eating that hyaline cartilage, the cushioning in the stabilization part of the joint. Or you get a referral to an orthopedic surgeon. You're just gonna have to learn to live with it. There's not much you can do. You're a good candidate for surgery, blah, 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 blah. Insanity, same thing over and over, expecting to get different results. That's kind of where we're at in this culture. And then what's the secret? So when it comes to arthritis, with knee arthritis, we have a machine, it's in that room over there, and it's called a knee on track. So it essentially stabilizes the upper part of the leg and the lower leg, and then it creates a distractive force of about 5 to 11 millimeters. So it kind of pulls the joint apart, and that sucks fluid back into the midline of the joint, pulls the good stuff in, pushes the bad things out. And then we can do that along with some of our regenerative medicine protocols, like PRP or even stem cell, and they can actually rehabilitate and regenerate the knee. And is anybody going through a knee program right now? I don't think there's any. We have some knee cases. Through that?
Replacement and stem cell.
Oh, you did both?
Yeah.
Which one did you do first, the stem cell?
I did stem cell on both knees.
Uh-huh.
One knee was shot, too far gone. So I ended up with a replacement. The other knee was early, corrected it.
Yep.
So it did work.
Yep. That's the trick with all of these things, is the earlier the better.
Yeah.
But the problem is with chronic conditions, the pain and the symptoms are usually the last thing to finally manifest. We always say the pain is the last thing to show and it's the first thing to go. So it's the last thing to show up with a chronic problem. It's the first thing to go away once you start kind of moving in the right direction. I had in my knee, this was in August, I had stem cells and PRP done in my right knee. Every time I would play basketball or even running on the treadmill, it would puff up and I couldn't bend my knee. I certainly couldn't squat down on it. Couldn't play basketball. And I got the stem cells and PRP in August. And since about really early October till now, I've been playing basketball once or twice a week. And I'm old, most people don't care about playing basketball, but if you know anything about it, that is very stressful on the knees and completely pain-free. It feels like now this other one's bothering me a little bit, but it's time to double up there. So anyway, the options are not just drugs and surgery, just so you know. We have a class 4 laser therapy, which obviously is good for knee pain, but we use it on people's sinuses, or Miss Linda here uses it for cognitive brain issues, and you can use it for lateral epicondylitis or elbow problems, wrist, foot, almost any joint pain, typically foot. She had the foot with it. So it's an amazing application for different conditions. It's anti-inflammatory, analgesic, accelerates tissue repair and cell growth, improves vascular or basically blood flow activity to the area, and it also helps to improve nerve function. And the way it works is it penetrates through the skin, through the epidermis, dermis, past the fat. It could even get down into the actual joint itself, and it's completely painless. So it feels like you have a warm red light just rubbing on your skin. For most people, they feel like how could that do anything? It feels like you're shining a red light on my knee. How could that even do anything? But it penetrates past the pain receptors that are in that top layer of skin. So it decreases inflammation, nerve regeneration, increases cartilage, bone, muscles, collagen production. Pretty amazing stuff. 377 different peer-reviewed references when it comes to laser therapy. I won't bore you with that. And now the new technology that we're rolling out with the help of Nurse Liz is PRP. Has anyone ever heard of PRP? Platelet-rich plasma. That's a more common orthopedic application. Now the old way that they used to do this was they would draw your own blood. So they'd take a vial of your blood and they would spin it so they could pull out the platelets in the plasma and kind of separate it from what they don't want. and then they would inject that into the knee or into the shoulder, into the elbow. So it's all natural and it's coming from your own body. But the problem with that is, like, they're taking my 45-year-old platelets. The ones that we use are from umbilical cord. And just as a disclaimer, I am extremely pro-life. So what they do is they take scheduled C-sections, and instead of throwing the placenta and the umbilical cord away, they actually harvest that little bank of supercharged, powerful, undifferentiated cells, ones that haven't really become anything yet. You ever notice, like, when a newborn baby, if they're really, really young, or even in utero, if they have like a surgery, if they have an open heart surgery, they'll rarely ever have a scar. You ever notice that? If you cut on me, I'll have a scar forever, because their stem cells and their platelets are so young and so powerful and so undifferentiated that those can really literally become anything that your body needs. So that's one application. Ankles, knees, wrists, shoulders, elbows, back and hips. People say, well, how does it feel? Well, it feels like you're putting a needle into your knee. So it's not painful. There's a little bit of a prick, kind of like giving blood. It's sort of that similar. And we numb it with, a spray that kind of calms everything down, but not painful at all. And it's actually using growth factors that allow your body to heal itself versus cortisone, which is rotting, destroying, and decaying the joint. That make sense? It's a completely different ballgame.
So that's what you guys are doing here too?
Mm-hmm. Yep, that's another thing that we offer. And we also offer, so the company that we use is this VD Labs. So VD Labs, I've done some research on multiple labs. This seems to be the one that's at the top of the food chain. They work with the Los Angeles Rams and the Oakland Raiders and the hockey teams, and a lot of the sports athletes will use this. But this is where we get our stem cells, and we also get the PRP. So same, and stem cells a little bit different, but similar applications for joints. But you can also use the stem cells through an IV, which allows, the simple of this is that they will find where your body needs help, essentially. The stem cells.
Is that the difference between the two? Because I never really understood that.
Yeah, well, the PRP is just a platelet-rich plasma, where the stem cells have growth factors and cytokines, and there's just a lot more to it. Yeah.
And where do the stem cells come from?
Same.
From the
Umbilical cord. Yeah, they're amniotic mesenchymal stem cells. So they harvest them. They put the donors go through tremendous amounts of testing. They make sure they've never had the COVID shot. They make sure they're not on any kind of active medications. They screen them for healthy people, and then they send that batch off to the lab to be screened further. So it goes through multiple layers of screening. And I had no reaction to it when I had it done. Yes. Yeah.
So is the stem cells that much more advantageous than the PRP?
More powerful. Yeah. I can't give you a percentage. That's why when we do the stem cells, we'll do it with like a PRP booster. So it kind of all goes in the same syringe, and then you're sort of getting both. And I had it done in my shoulder about a month ago, and it's not 100% better, but 60%. And it takes time. Sometimes it takes, months before the results.
When I had my stem cell shot, I had 4. I had one in each knee and one in each shoulder. Because I was looking at 2 shoulder surgeries I didn't want to go through. It didn't work in the one knee because it was
Too far gone.
But the right knee and my shoulders,
Yep.
big difference. And they explained it to me like you just explained it.
Similar explanation.
Where it came from and how powerful it was.
Mm-hmm. It is literally, and I always hesitate to see this because it sounds kind of gross. It's like the fountain of youth. It's where the most hope in regenerative medicine is going toward, where your body's actually able to repair tissue damage and joint damage and even organ damage, things that have been there for years, decades. It gives your body the ability to actually repair some of those problems. And it's not a panacea. I can't make guarantees, nothing like that. But when you're facing surgery or chronic pain or having to have replacements, things like that, for me, it's kind of a no-brainer.
Has there ever been any data to show your body's
Not really, but it's small, but it's also undifferentiated. So your body doesn't recognize it as like a foreign, like you heard of people that have had like organ transplants, things like that. No, the rejection rate, if that's what you want to call it, it's minimal to none. Now you can have some pain or some swelling the day after, and kind of like with any sort of procedure. My knee felt like I had like fluid in it for a few days because the product has to kind of sit there and then it slowly disperses over time. Now, if you do the IV application, you can have like what's called a Herxheimer's reaction, which is like an immune, because there are cytokines which trigger the immune response. So you can feel kind of flu-like for a day or two. And that's not everybody, but it's kind of a worst case scenario with things like that. But no real serious adverse reactions as far as I'm aware.
Is this a one-time application?
Depends on the person, depends on the damage. Nurse Liz would help us kind of sort all that out. Some people say that the stem cells will last at least a year. I've heard some people say that, it can last for decades. But I think it's person dependent. And then are you continuing some of the activities that, like we have a lady that had it done in her hip a month or two ago, but she runs about 7 triathlons a year. So is she going to be a one and done? Probably not, because she's not going to stop running. So I think it depends on the individual person. Mm-hmm. Yep. And when you take these things with the PRP and with stem cell, you can't take like anti-inflammatory medication at all, because it'll ruin the product. So like Advil. Okay, medication. Yeah. Turmeric's okay. You wouldn't want to take like a super heavy dose. I think even for the first 30 days, you gotta. I quit taking turmeric for 30 days. I was babying my stem cells. So, any other questions on that? It's a tissue bank, AATB accredited, CGMP, FDA registered. So they've jumped through all the hoops.
Would Claritin mess up with the cells and stuff?
No, I wouldn't think so.
Okay, good, because that's my allergy medicine.
Yeah. No, I think we're okay. It'd be nice to get you off the Claritin though. Yeah. And the big thing with a lot of allergies, and we'll talk about this in another previous workshops, is this list right here. Because allergies, asthma, even arthritis too, is driven by these inflammatory foods and inflammatory lifestyle. So avoiding the breads and the pastas and the cereals, and then just eating more real healthy whole foods. And then we're talking about some of our blood work and some of the metabolic panels that we're able to run now. This is Chem 77 LabCorp testing. So this top line, this CMP12, is basically probably close to your traditional doctor's lab work. So when you go in for your once-a-year physical and they draw your blood and they check your CBC and your kidney function and your liver function, that's essentially what that test does. Now the problem with that, if nothing shows up on that test, they say, well, you're healthy as a horse. You look great. And then people have heart attacks a month later, or they get cancer a year later, or they get whatever. So what we do is we do this panel, but we also add the homocysteine, which is an inflammatory marker, particularly for cardiovascular risk. Vitamin D. Has anyone ever had their vitamin D checked? Yeah. Yep, that needs to be a standard. Every time you give blood, you get your vitamin D level checked. Because low vitamin D levels are associated with osteoporosis, which a lot of people know that, but also with allergies, asthma, about 6 different kinds of cancer, cold and flu. Do you know why there's a cold and flu season? Where do we get vitamin D from? Yeah, when does it magically disappear, cold and flu season? Right. So I think there's a correlation there? I think so. And we want our blood levels to be between about 60 and 80 on your blood test. So make sure when they tell you, yeah, your vitamin D looks good, say, I want to see the number. Show me the number. Because their range is between 30 and 100. So as long as you're at 31, you're fine. You're good. 30 is the cutoff for rickets. Does that make sense? So like these recommended daily allowances that you'll see on vitamin pills and you'll see on blood tests, as long as you're within the range of whatever, those are set up for deficiency and toxicity. Somewhere between having so little that you have a deficiency disease or having so much that you're actually toxic. That's their range. Well, within those ranges, there's also like a health and wellness optimal range, which is where we want to see people fall.
What is that again?
60 to 80 on that OH or the OH 25 hydroxy test. Depression, anxiety, seasonal allergy, seasonal affective disorder. Yeah, because it's vitamin D is really not it's not a vitamin, it's a hormone. And it's the precursor, the building block of all of your sex hormones. It's a crucial component to the normal function of the immune system. So without vitamin D, and that's what they noticed with early on with COVID, like people that had normal vitamin D levels, they just weren't going to the hospital. But did they ever recommend taking vitamin D? No. Or losing weight or exercising. We closed the gyms as we kept the liquor stores open, right? And we let them do that. That's
you could tell friends and family though, like about
right.
vitamin D, and they would look at me like I was mental.
Mm-hmm.
And then it became that I felt like I just couldn't talk to a lot of people that I knew anymore.
It's hardest to reach the people closest to you.
Yeah, you think I can help.
Mm.
And it's what's interesting is some of my family members will like husbands I'm having heart problems.
Yeah.
Never had a heart problem in their life.
Mm. Yeah. Yeah, there's a new, you ever heard of SIDS? You heard of SIDS, sudden infant death syndrome?
Yeah.
Now they have SADS, sudden adult death syndrome.
Oh my gosh, yeah, I read about
Yeah,
that.
so it must be SADS. Like, give me a break. Yeah, I mean, medicine, traditional medicine is going to lose so much credibility. The problem is it's going to start to affect things that they really do well, that we need them for, that they excel at. So I think that the pendulum's going to have to swing back the other way, or we're in big trouble. Because that model's not really going to change. Like there's no money in healthy people, not in the sick care system. There's no money in healthy people, and there's no money in dead people. The only money is sick people who are scared, sick, suffering, rely on medications, who are uninformed. That's where the money lies. So as long as you're one of those people, you're a great customer.
Well, in the food too that they are putting out now.
I thought they're trying to kill us in the hospital when we had our baby.
Discussion a lot. My mom is 4 years older than me.
Mm-hmm.
And, well, we didn't have to do it. Yeah, but the food that she ate
Correct.
at my age, at 45, 44, was not never pumped full of nothing.
And you
Like,
need
you didn't hear the word organic because
that's what it was.
the farm.
Right. That's
Now,
exactly right.
It's like, I have to pay more for my groceries and relabel because this child, I want to be able to make it to 85.
That's right.
Healthy. So,
And we needed about 8 bowls of spinach to get the same nutrient requirement or same nutrient content as my grandparents did when they were kids.
Wow, that's insane.
So even if you're eating organic, which is great, keep doing it, but the soil is over-farmed.
Yeah.
They don't cycle the crops anymore. It's all this unicrop hydro. Right.
Well, yeah, all that is very accurate and true. But in the end, it does fall on the person themselves.
Correct.
Themselves to do the right thing.
Yep.
For themselves. I don't know how many conversations I've had with my doctor, and my doctor, my MD, has said the same thing I've said, because he's sad to see a lot of the people that come into his office year after year after year, and they want a fix, but they really don't want a fix. They want a get quick pill.
Yep.
And he likes seeing me come in. His face lights up when I come in, because if he says something and I don't necessarily agree with it, he likes that.
Yeah.
Because I have conversations with him and about health. And that's what he likes, because he doesn't get that from anybody else. They just want, this is what my problem is, give me something to fix it. And that's not really what doctors want.
But their hands are tied. I mean, they're limited to short number minutes during the visit. They're reimbursed by the drug companies. And as long as the doctors are reimbursed for treating sick people, versus being reimbursed for keeping people from getting sick, the system's never going to change. It's the compensation structure.
And that's what something like this is so important, because knowledge is power.
Yep.
And we have an opportunity. The people here have an opportunity to really do something about it.
100%. Thanks for that, Dave.
And did you read just in the last week that the Pediatric Doctors Association has come out and said that childhood abuse of obesity is a disease, and they are now recommending medication.
Of course.
Wow.
Yeah. Yeah.
And surgery for a teenager.
Yeah, it's almost 60% of our teenage kids are either overweight or obese. I mean, where does this stop? When it's like 99% of them?
School systems too. Like when
Right.
I used to teach in Metro Public School, and we started getting breakfast.
Yeah.
Okay, so you've got these kids that are hyper or ADHD or ADD.
French toast sticks and
First ingredient on the list, high
Lucky
fructose
Charms.
corn syrup.
well, Lucky Charms are healthier than eggs.
Or
Do you know that?
waffles, it's all crap.
That's the
And
new
then, like,
nutritional.
midday, these kids are crashing
Yeah.
because their sugar's gone.
Yeah.
Like, this is insane.
And she brought up a good point. That's true. She brought up a good point about Lucky Charms. If you look at the new dietary guidelines that have been released, they show basically each type of food and how healthy it is on a bar graph. Lucky Charms are actually healthier than eggs. They're healthier than steak. Look that up. I posted that the other day. But I'll show it to you.
I don't eat Lucky Charms,
I don't either.
but I do eat eggs.
But that's just the insanity and how in bed these companies are with big food, big pharma, big corn, big dairy, big sugar, big soda. Like those, that's follow the money.
I've said it for years. Like I've been homeopathic essential oils for the last 7 years.
Mm-hmm.
And I've said for years that if more people, if we could get back to that,
Yeah.
we used to have the apothecaries. Why do we not anymore? Because of big farm.
Right.
If they can keep people sick, then they make money. If we can switch the pendulum or flip it, then it would put big farm out of business.
Right.
Because
But it takes us taking ownership. Kind of Dave's point with this is who's responsible for your health. So then who has to be the expert when it comes to your health? Sadly, not your doctor, not your spouse, not your friend. We have to be the experts when it comes to our own health because we're responsible. Iron, TIBC, thyroid antibodies. Most people, anyone ever had a thyroid test done? They check your TSH, your thyroid stimulating hormone. If that one test says you're good, you're good. Well, that is like looking at a tail and saying, well, this must be an elephant. Like you're getting a small piece of what that thyroid's doing. So antibodies, T3, free T3, C-reactive protein, which is an inflammatory marker, which we should all have done regularly, reverse T3, T4, and then thyroxine binding globulin. So much more in-depth panels.
Everything below iron is thyroid related?
Except for the C-reactive protein. But your thyroid is just a crucial cog in the wheel. So if it's malfunctioning, then your entire metabolic system is malfunctioning. So that's a good marker for how your adrenals are likely doing and how your hypothalamus is talking. So it's part of all those feedback loops. And then we do this Cyrex array number 5, which is an multiple autoimmune reactivity screening test. So it tests 24 different tissue antibodies. So it tests your ovaries, testes, collagen, your bones, your 24 different tests to see where that inflammatory response is actually affecting your body. So it's very specific. Leaky gut. Does anyone have their phone on them? You have your phone? Google what percentage of Americans, do it in your thing, in your voice. What percentage of Americans have leaky gut? Just say what percentage, go to your voice. Okay, you can do it that way. Let me do it real quick. I'll get you, Adam. Sorry, buddy. What percentage of Americans have leaky gut? Of course, my internet's slow in here too. It's 90%, by the way, just so you know. So it's 90% of Americans have leaky gut. Who's ever been to the doctor and been told they might have leaky gut? Other than, yeah, you go to the good doctors though.
I had a chiropractor.
Right. All the weirdo docs. So what happens is these tight junctions, so there's a single cell layer that separates your gut from your bloodstream. It's one little thin layer of cells, and what happens is those get damaged from gluten, microorganisms, toxins, parasites, casein, which is from dairy, and it opens those tight junctions and allows your food to enter your bloodstream. And then that travels throughout the body and might affect your thyroid, or it might affect your kidneys, or it might affect your achy left knee, or it kind of finds your weakest spot, and generally that's where it affects. So we have to find out if you have leaky gut and then what tissues that it is affecting. So we have this 10-week detox, gut repair / detox. So it's to actually heal that single cell layer that's surrounding the gut. So we have now a process to get the gut repaired. It's from Apex Energetics. You can't get that on Amazon. It's all medical grade. It's high quality stuff. So
You sell it here?
we do. Yeah.
It does work.
You've used Apex before? Oh, that's right. Yeah.
So you feel better after you do that?
You tell them a little bit of your story. Do you care?
Yeah.
You don't have to.
No, I don't mind. I've been seeing Ben for over a year and a half, and for balance issues. And we kept trying to do better, and not so well. Finally he sent me to people in Mississippi, and we got diagnosed with the beginning stages of peripheral neuropathy. And it came from a leaky gut. The toxins went to my
Cerebellum.
and,
Left temporal lobe.
Yeah, left temporal lobe. So I slur my speech sometime when I get nervous.
I'm sorry to put you on the spot.
The laser's working on that. But the leaky gut took me 21 weeks, and I'm walking, I'm jumping in place, I'm doing lots of like it was so bad that I was in his office or one of the rooms, and he's a good friend of ours, like family now. And I said, Ben, my husband says, if I can't live a normal life, I'm ready for it to stay down. And he said, no, you're not done. And he sent me down there and diagnosed.
Yeah, we did all those tests and.
Stem cell,
Yeah. You're awesome, Linda. Thank you.
Thank you.
Yeah, so imagine, and this is simple stuff, like going up and down the stairs easier, getting out of the car without pain, walking, playing with your grandkids. And that's the thing too, is most people will do more for the people around them than they'll do for themselves, for their kids, for their grandkids, sometimes even for their spouse. So really, like, why do you want to be healthy? I would ask everybody to kind of identify, spend some time at home. Like, why do I want to be healthier? Because usually it's not because I want to look better in a bikini or I want to sleep with less pain, but those are good, right? But the real thing is, I want to walk my daughter down the aisle. I want to play with my grandkids. I don't want to be a rocking chair grandparent who's staring at a tray full of pills, just having a stranger give me a sponge bath. Nobody wants that. But sadly, that's where a lot of people end up. I remember my grandfather used to say, if I ever get in that situation, just put a pillow over my head and shoot me. And we'd all laugh, like, ha, ha, ha. But that's not how it played out. Like, he did 8 years in a nursing home. He was terrorizing the staff. My dad had to go up there every single day for like 4 years, every single day, to babysit and take care of him until he finally just faded off. So that's not what anybody wants. But the reality is, if we don't take action and make change, then that's the end that we're facing. So what do we do from here? Reserve a spot for a consult with Nurse Liz. She'll do a full history, full exam, evaluation, get an idea of what your goals are, what you're looking for, and then she'll help direct as to what the appropriate testing needs to be done, what treatments. She'll kind of guide you through that process. She's been doing this for a long time. We ask to bring the person closest to you because we know that health is a family affair, and a lot of times we'll ask the spouse things about the person who's the patient that can give us a lot of insight too. So consultation evaluation is normally $249 to meet with her. If you sign up for it today, she's here every Wednesday, so she's going to be here Wednesdays forever. She signed a lifetime contract with us, so she can never, ever leave. So it's just $100, and the $100 will apply toward whatever you have done. So if you need testing, you need supplements, you need whatever, that $100 will get applied toward that. If you meet with her and you find out that there's nothing that you need or you want, then we'll just refund you that, or you can apply it to your chiropractic care. I don't care. But she also does a lot with men's and women's hormones, the bioidentical creams and pellets. Am I missing anything?
Yeah, hormone. What else?
Yeah. Sorry, I put you on the
I do
spot.
other stuff. I know this is.
Food allergies, she asked.
Yes, some food allergies, and then what else? But I need hormones. I love hormones.
Yeah, I love hormones.
I do. I think because I was 42 years old, and when I had to have
Last year.
last year, I had to have a total hysterectomy, and it was like somebody else had entered my body. I mean, that sounds kind of woo, but my whole personality, everything changed, and I became very depressed. And a friend of mine who lives in Houston said, "Liz, are you familiar with bioidentical hormones?" Well, then I wasn't, but I began to just devour everything I could read about it and any kind of research out there. And I realized, so for me, it totally restored my life. So that's why I think it's something that it's a tool. It's something that can really help men and women.
Mm-hmm. Totally agree. And, I've always been Mr. Natural. You don't have to take a pill or a supplement. Just get it from your food. But reality is the food's over-farmed, it's nourished. We're dealing with a lot of plastics and toxic air and toxic carpet fumes, and we're just under more burden than I think the human species was ever designed for. So we just have to plug in those gaps with multiple different treatment modalities. It's not just adjustments or just hormones or just diet or you kind of have to do a little bit of all of it. But the good thing is most of you guys are already checking a few major boxes. If you're in here regularly, you're taking care of your structure, that's a big box. Your nervous system's functioning better. Hopefully you're eating a little better. But for all of us, like there's probably somewhere else where we could fill in the gap. So.
Is there a price, like any type of price breakdown on that?
On the
Yeah.
I mean, it's all individualized. It's based on like what testing you need to have done, and then
Will this determine that?
yes, yeah.
Insurance taking on any of that? Like,
no, we're kind of working through some of the credentialing process. Maybe at some point some. So we're going to try to discount like the self-pay that would hopefully equate to what when we do have insurance that'll equal out to. But by and large, a lot of these tests and some of the like the 10-week detox, I don't care how good your insurance is, they're not going to pay. But
even like the lab work wouldn't classify like a well visit for insurance purposes.
You want to answer that?
That's what I've been looking into today. I called a couple of labs to find out if maybe they could come and discuss with us ways that we can incorporate people's insurance. So it may not cover everything, but definitely it will help.
And we could always write you what's called a super bill for everything we do, and you could submit it to your insurance, which a lot of people have better luck that way because the insurance company works for you, not for me. So we could always give you like an itemized super bill, and then you could submit it on your own.
I know when we had talked about this, that we went off of the chart, we were doing something different, and like IV vitamins.
Yes, thank you. Yeah.
Is that?
Yeah, hydration.
Yeah.
Yeah, that ultimately is going to be our hydration suite. We're going to move all that stuff into the very back. So we'll have like the Myers cocktail, the glutathione, NAD, vitamin C, like.
So this testing will also determine what your.
It can, yes. If you express that as one of your interests, we can.
All of the above.
Okay. Yeah, we just have to.
Can you talk a little bit more about the IV therapy stuff?
Like IV hydration and IV therapy. Yeah, so we're going to create.
I have to go. I'm sorry. Can I book her appointment when I leave?
Yeah, Jess, you up front?
Yeah.
Yep.
I'm sorry.
No, you're good.
Thank you.
Your first one on the books. I see what you did there. I gotta go. Sorry. Yeah. Do you want to comment on the? You can stand up if you want. You have the floor.
The IVs can be really, really helpful. I think, though, that now it's such a fad. You know, it's embarrassing to say, but I have a son who's 34, and every time he drinks, he goes and gets his IV, you know? So, or they go party, they go get an IV. So I think it's like a fad. But in reality, Myers Cocktail, I have a friend that works in a rheumatology office just north of Nashville. Oh, what's that?
Getting on camera.
Oh. Anyway, I'm shocked. Anyway, and I asked the nurse practitioner that works there, I said, you know, what do you do there? And she said, we give a lot of Myers Cocktail IV. And that made me really interested. And I said, does it help? And she said, absolutely. With all the symptoms, it was really helping. And Myers Cocktail is just vitamins and yes. And so I think these things do help. I really do. I mean, not to overdo it. I don't really believe, you know, you can go and just have a menu and say, oh, today I'd like this, or, you know, because I think you have to know what you're putting in your body. I have some concerns about the IV magnesium because that can be very dangerous unless it's really, you know, you really monitor the patient. As we know,
magnesium has to be balanced with the amount of
potassium, sodium,
in your body.
Yes,
So that it doesn't
absolutely,
overrun you.
absolutely. Or you could end up having heart problems. Yeah. So, you know, I think there's certain things that you really have to monitor it. Another thing is, for example, well, there's the NAD. They have all kinds of immune, for example, if you're immune, you know, compromised. And then, I mean, I saw some really good success. For example, I had patients that, you know, during the whole fear of COVID and everything, would do the vitamin C and the zinc, and they would do the IV and did extremely well. So I think it does help. Yeah.
What are they made of? Are they like synthetic vitamins and minerals? Or are they like natural?
It depends where you get them from, but you can in fact go through, you know, one of the natural pharmaceuticals. I don't know what they call themselves. Probably not pharmaceutical.
Nutraceutical.
Yeah.
Yeah, that's our supplier will be that.
Yeah, well, they tell you exactly where everything comes from, and so you know you can be very careful what you use.
And most things that we take orally will be broken down by the stomach, so the absorption rate is really, really low. That's why you never take oral glutathione. It's just a total waste. But if you do it through an IV, it doesn't get metabolized as quickly and easily, so your body absorbs a lot of what's in that cocktail.
Plus, if 90% of people have leaky gut, then you're assuming your gut's even absorbing
Sure.
what you take orally.
That's right.
Point. That's a really good point. Yeah.
Thank you. All right.
I got something I want to share with everybody. You mentioned the organic food, a lot of this relates to that. The organic food that you see in the last years, it's become popular. Everything in the grocery store is marked organic, organic. Very few things do you see that are marked certified organic.
Right.
Major difference.
Yep.
Organic is anything. I mean, you can stick a tomato plant in the ground and just don't put any commercial fertilizers or insecticides on it. That's organic.
Yep.
To be certified organic, I mean, your soil has to be tested, your water's got to be
Sure.
tested, and on a regular basis. So there's a major
Anything with carbon is technically organic. So,
difference. Yeah.
but yeah, if it's certified, and even then people say, well, can I trust that? You know, I trust it more than not, I guess.
I know a couple of farmers around here that are certified. It's not an easy thing for them to go through.
It's not a great business model for them, for sure.
Yeah. I mean, it's tough for them to go through it, but they can, you know, put their product out and be certified.
Right.
You know, it's a little more expensive, but you actually know you're getting a good product.
Yep. And when you're making that shift, change your meat and dairy products first, like go free range organic, no hormones. Do that first instead of your veggies and fruit if you had to pick between the two, because your meat and your dairy and your eggs, those bioaccumulate toxins over the course of the lifespan. Whereas a tomato gets sprayed once and you eat it, a cow is years of accumulation. So you always want your meat and animal products organic first, ideally.
And I always, when I first started going that way, it is expensive.
Mm-hmm.
There's a thing called the Dirty Dozen list.
Yep.
When it comes to fruits and vegetables, but I try to tell my mom, I'm like, if you're gonna buy, I know it can be expensive, but like there's certain vegetables that don't necessarily and fruits that don't have to be organic, like bananas or pineapples, because of the
cheat sheet is if they spray the pesticide and it lands on the part that you eat, always get that organic.
Right.
If you peel it off and don't eat it, generally don't waste your money on organic.
But that's where I started because you know it is expensive.
Yep.
So it just is a peace of mind to know.
Right.
I know I can tell a difference in my own health. I'm not sick. Rarely am I sick or just have allergies or anything because I've changed my way of eating.
That's great. It's huge. Food is medicine.
You know, another thing, organic has been a big thing in the last 7, 8, 10 years.
Yeah.
You know, and they can charge a lot more money because they can say it's organic. But when you see a bag of apples on a shelf, it says organic. You know, and that tree that it came from has been there for 30 years.
Right.
So it's not being grown organic and certified. It's just somebody putting fertilizers on it.
Correct.
So you know, again, it's all about the money.
That's so.
Organic nails.
Huh?
What the heck? You seen that? The salons? They have
Organic nails.
Nails.
That's why I don't do fake nails. I don't want to mess with that. So.
But you can see the difference though in the size of fruits, like the organic apple versus an apple.
Well, yeah, the
like, there's so much
conventional
smaller.
apple's big and shiny and beautiful, and the organic one's been kicked down the aisle like 50 yards, bruised and dirty. But yeah. All right, I got to get everybody out of here. So make your appointments. If you got questions, I'll stick around. So thank you guys.